class. My name is Eva Varghese, and the article I'll be presenting on today is called Airway and Feeding Problems in Infants with Farber-Robin Triad Deformities. So what is Farber-Robin Triad? The triad includes micronanthia, which is a small mandible, cleft palate, and upper airway obstruction due to glossoptosis, also known as the retraction of the tongue. The next definition, perinatal period. The period shortly before and after birth, and neonatal period is the first 4 weeks after birth. So what is the research question? The question is, what is the incidence of airway feeding difficulties in the neonatal period, as well as the surgical and nutritional management for infants with Farber-Robin Triad Deformities, or FRT? Rationale. The outcome of this study will be of significant value to many professions in treating infants with FRT, since it has not been studied extensively or has been well documented. The purpose. Number 1, identify the number of patients with FRT that were presented at this clinic over a long period of time. Evaluate the characteristics of this palatal deformity, including associated airway obstruction and feeding difficulties, and to analyze interventions provided in order to optimize growth of infants with FRT. Participants. So this study is different from others in that it used medical records of the 215 infants with FRT and not the actual infants. And these infants were patients from the University of Pretoria Facial Cleft Deformity Clinic in South Africa, and they were patients from anywhere between 1983 and 2013. So the method. The patient's records of these 250 infants were reviewed and analyzed to measure the quality of their pre-surgical care and their post-surgical care. All the data was collected by 2 researchers with written consent from each parent of each infant. Demographic data such as sex, age, and etc., characteristics of the palatal deformity, and associated airway obstruction/feeding problems during the perinatal period, and surgical management outcomes were analyzed. So the results. About 37.7% of the infants that were analyzed had feeding difficulties. However, surgical interventions were seldom required to manage these feeding difficulties and airway problems. Most of the infants who had upper airway obstruction and feeding problems were treated with suction and drinking plates. And I have a picture of the suction and drinking plates right here. And pretty much what it is they go to a dentist and they get custom-made plates put into their mouth, and they're made with plastic, and they pretty much just fill the shape of the hard and soft palate and extending forward to seal off the nasal cavity from the mouth so that no breast milk falls through or food falls through. This in turn reduced airway obstruction in 70.6% of infants and feeding problems in 62.4% of infants. So discussion. This article draws attention to the importance of these custom-made suction and drinking plates in the treatment for FRT. And since this study is the first of its kind, there are not many studies on feeding problems in the FRT population to compare the results to. And also, the 215 patients with FRT reviewed represented the largest amount of participants in an FRT study, therefore showing higher significance and variation. And the picture I have here are some more feeding methods used, and they're just bottles that can fit towards the cleft palate. So my assessment on this article. This article does a great job in providing a large sample size, which is always ideal. Since a large amount of infants with FRT have feeding difficulties, this type of study was necessary because to learn more about the topic and effective treatments. While there are many limitations to this study, it also has potential to be recreated but in different experimental contexts. My suggestions for further research are that further research needs to be done on how parent education and a successful feeding program can affect hospital stay and the length of the hospital stay. Also, research on different types of feeding methods for infants with FRT who have either mild or profound feeding difficulties. And also the effectiveness of oral stimulation therapy on infants with FRT, which is mostly done by SLPs. And this is my reference. Thank you so much.